Our feet are intricate structures that bear our weight and allow us to move. Ligaments, strong bands of tissue, connect bones and provide stability. A ligament fracture in the foot is essentially a sprain. This means the ligament has been stretched or torn. Overstretching or tearing causes pain, swelling, and difficulty walking. These injuries often occur during sports or everyday activities. Understanding ligament fractures helps in prevention and care. Proper treatment ensures recovery and prevents complications. Ligament fractures in the foot are often caused by sudden, forceful movements that stress these connective tissues beyond their limits. Sprained ankles are common, occurring when the foot twists inward, stretching or tearing the ligaments. This can happen during sports like basketball or soccer or from a simple misstep. Overuse or repetitive stress is another common cause. Activities like long-distance running can weaken ligaments over time. Proper footwear and training techniques are crucial for prevention. Conditions like arthritis or neurological disorders can also increase the risk. These conditions alter foot biomechanics, making injury more likely. Anyone can experience a ligament fracture regardless of age or activity level. Understanding causes and risks can help you take preventive measures. Knowing the symptoms of a foot ligament fracture is crucial for seeking timely medical attention and ensuring proper healing. While the severity of symptoms can vary depending on the extent of the ligament tear, some common signs indicate a potential fracture. One of the most immediate and noticeable symptoms is pain. You might experience a sharp, stabbing pain at the time of injury, which can then subside into a dull ache. The pain typically worsens with weight-bearing or movement of the affected foot. Swelling is another telltale sign, often appearing around the injured area within minutes or hours of the injury. In addition to pain and swelling, you may also experience bruising, tenderness to touch, and a feeling of instability or giving way in the joint. These symptoms are often accompanied by difficulty walking or putting weight on the injured foot. In some cases, you might even hear or feel a popping sensation at the time of injury. It's important to note that even if your symptoms seem mild, it's still crucial to seek medical attention. Ignoring a ligament fracture can lead to chronic pain, instability, and long-term complications. Early diagnosis and treatment can help prevent these issues and ensure a full and speedy recovery. Treatment options for a speedy recovery. Treating a foot ligament fracture typically involves a combination of approaches aimed at reducing pain, stabilizing the injured joint, and promoting healing. The specific treatment plan will depend on the severity of the tear and the individual needs of the patient. For minor sprains, the RICE protocol is often the first line of treatment. This involves rest, ice, compression, and elevation. Resting the injured foot, applying ice packs to reduce swelling, using compression bandages for support, and keeping the foot elevated can significantly alleviate pain and promote healing in the initial stages. In more severe cases, immobilization with a brace or cast may be necessary to restrict movement and allow the ligament to heal properly. This helps stabilize the joint and prevents further damage. Your doctor may also recommend over-the-counter pain relievers or prescribe stronger medications to manage pain and inflammation. Once the initial pain and swelling subside, physical therapy plays a crucial role in restoring range of motion, strength, and stability to the injured foot. A physical therapist will guide you through exercises tailored to your specific needs, gradually increasing the intensity and complexity as you progress. Conclusion: taking care of your feet. Our feet are our constant companions, carrying us through life's journey. Ligament fractures, while common, can disrupt our mobility and affect our quality of life. Understanding the causes, recognizing the symptoms, and seeking timely treatment are crucial for a smooth recovery and preventing long-term complications. Remember, early intervention is key. Ignoring the signs of a ligament fracture can lead to chronic pain, instability, and difficulty performing everyday activities. By seeking prompt medical attention, following your doctor's recommendations, and actively participating in your rehabilitation, you can ensure a full recovery and get back on your feet. Taking care of our feet should be a priority. Wearing supportive footwear, practicing proper warm-up exercises, and being mindful of our surroundings can go a long way in preventing these injuries. By prioritizing foot health, we can continue to enjoy an active and fulfilling life.